Let's talk about ovarian stimulation and the risks of having more eggs and the risks of having more eggs on the endometrium. Now, ovarian stimulation is a key part of IVF where hormones are used to create more eggs. And the goal is the more eggs you get, the more embryos you get, you're giving the patients a chance of a better pregnancy. And generally, there's been a debate on mild and maximum stimulation. And there's been one paper which has said that more may not always be better. While high dose protocols may increase egg numbers, there's that small possibility they may harm both egg quality and the lining of the uterus, which is in the endometrium, which is crucial for implantation. There are studies which have found that the optimal range of how many eggs you need is between 6 and 15 per cycle, where the high birth rate are the highest. Retrieving more eggs doesn't necessarily improve success and can reduce healthy pregnancy. What has been noticed is that high doses of hormones can lead to eggs with more genetic or structural abnormalities, changes in metabolism, and altered gene expression. These changes can lower the chance of fertilization, embryo development, and a successful implantation. That's based on some studies. The uterine lining can also become less receptive due to hormone induced changes, making it harder for embryos to implant and grow. The other potential long term impact is there's some studies which look at children born from high dose stimulation, and they may be smaller for gestational age, having metabolic issues, and even high blood pressure in childhood. Research is still awaited on those, but remember, all these have been on fresh cycles. To address this issues, many clinics have moved towards a milder protocol, and the aim is to find a balance between egg quality as well as and quantity as well as the endometrium. Another approach is to do a freeze-all, and a freeze-all takes the embryos outside that environment, and which many clinics have moved to. This allows for the uterus to recover and help for implantation later on. And maybe as time goes by, we'll know a lot better about how the endometrium impacts in an acute IVF cycle. But what this paper says is that's probably best to get between 6 and 15 eggs. That's always not possible. And sometimes, even with normal responders, you're going to go much higher. And there, freezing embryos may be one of the options.